She was like, "How do you get rid of a double chin?" And I was like, "Surgery."
Surgery. The non-surgical treatments are not great, and you probably end up spending more, and then not much happens, and then you just have the lipo that takes 30 minutes.
If Kybella was really that effective,
Yeah.
nobody would be getting liposuction on their chin.
Totally.
You know what I mean? I actually know a lot of people that have tried Kybella, and I would say 90% of them are not happy with their end result. There's only been one person that I have met who literally, I think, only needed 2 sessions of Kybella.
I actually did the clinical trial for Kybella.
Yes.
And when we were doing the clinical trial, I also was doing liposuction at the time. Every patient in the trial came in every month, and they had 6 months of treatments, no matter what their results were looking like. That's how many they had. And we were allowed to gauge like how much Kybella we used based on how much fat they had. But basically, at the end of the treatment series, they had a lot of treatments. And every time you do it, there's swelling and discomfort, and then the fat gets kind of hard and lumpy. It takes a while to recover from that. And in my head, while I was doing the trial, I'd be like, why wouldn't these people just do lipo? And honestly, it may even end up costing the same or more. And then you go through all that unpleasantness. And I think when they first launched it, a lot of people were like, oh, well, maybe I'll be the lucky one who gets a good result with 2 treatments, because some people do. Some people seem to be good responders. But it's just I think the risk kind of outweighed the benefit, and people realized over time that it wasn't magical.
I'd love to know what about those special people. Like what is it?
Yeah,
Is it
like
some
what
kind of
makes them a
genetic
good
makeup that
candidate?
makes that?
They
Yeah.
probably have only superficial fat, because you can have some fat under the muscle that's not really addressed with Kybella. And also the skin tightening is an issue. So it probably has to do with the age of the patient and the quality of their skin, their genetics, their bone structure. There are a lot of other things that are happening in the neck that causes a double chin. It's not just the fat.
Right.
Are there any other options outside of lipo for this area?
I mean, there is a type of procedure called a platysmoplasty that addresses the muscle. It may be done in combination with lipo. Now we're getting outside of my scope of expertise here, but I'm, familiar with a lot of these procedures, but I don't do them. But the platysmoplasty is where they tighten up the muscle, also surgically, so they have to make an incision, but it's a pretty minimally invasive surgery. But if you have too much extra skin, unfortunately, you just have to pull it up and cut the extra skin off and reattach it.